Good afternoon, everyone, and thank you for attending our panel discussion on data set standards and data interface standards, what every HIM professional needs to know. I hope you all have gained a lot from the conference thus far, and we hope to provide you with some great informative takeaways from presentations. We have some really great speakers for today's panelist discussion. Our panelists will be covering 3 data set and/or interface standards. Those are HEDIS, OASIS, and CDISC, which I'll then allow panelists to introduce themselves and their topics. For the duration of the back-to-back presentations, we ask that you hold all applause and questions until all panelists have completed their presentations. We will have plenty of time for questions and discussions afterwards. So at this point, I will pass things off to our first panelist, Kendall Burleson, who will be covering Health Effectiveness Data and Information Set, HEDIS.
Good afternoon, everyone. I'm glad you're all here to discuss some of the prominent data set standards with our team. My name is Kendall Burleson, and I'm going to be providing you with a brief overview of HEDIS. Afterwards, I'll be happy to address any questions you have, and hopefully you'll walk away with an enhanced knowledge of several topics today. What is HEDIS? Well, it stands for Healthcare Effective Data and Information Set. Now, this data set has always been called HEDIS, but when it was created in 1991, it was originally known as the HMO Employer Data and Information Set. 2 years later, we got version 2.0 in 1993, and the name evolved to Health Plan Employer Data and Information Set. 4 years after that, in 1997, we got the third version, and finally in July of 2007, the name changed again to Healthcare Effectiveness Data and Information Set, the name that it's known by today. HEDIS was developed and is maintained by the National Committee for Quality Assurance. Now, the NCQA is the leader in healthcare accreditation, both for health plans and provider organizations like ACOs. HEDIS is a registered trademark under NCQA. HEDIS was designed to provide insurance purchasers with the ability to compare the performance of managed care healthcare plans. HEDIS collects administrative, claims, and health record review data. It collects standardized data about specific health conditions so the success of various treatment plans can be assessed. HEDIS contains more than 70 measures related to conditions such as heart disease, cancer, diabetes, and osteoporosis. It also includes data related to treatment processes and outcomes. Health plans often release data from HEDIS studies publicly in order to document substantial positive effects on the health of their clients. The uniform collection methods of this system allow comparison between plans. Data is collected from the health records in clinics and hospitals. The data is collected about treatment processes used by the clinicians, as well as the patient outcomes of that treatment process. So there you have the overview of HEDIS. Thank you for listening. I'm going to pass it off to my fellow panelists, and I'll look forward to your questions.
Thank you, Kendall, for that presentation covering HEDIS. You covered some great points that a few of our audience members will benefit from in their HIM roles. Our next panelist is Juan Lopez, here to talk to you all about Outcomes and Assessment Information Set, OASIS. Let's take a look.
Good evening, everyone. My name is Juan Lopez. I am part of Team Purple. I'm going to be going over the OASIS data set. It was developed by the Center for Medicare and Medicare Services, and its implementation is, as of this year, was scheduled for its initial implementation in January. And we're going to go ahead and look at a couple of quick discussions about the background of OASIS and some of the data sets where you can get the resources to start using it in training mode and real life mode as well. Okay, so let's look at some of the background information. The current version of the OASIS dataset is available on the website, but also you can also get the legacy versions alongside. For example, if you're still using version 9 instead of the current version 10, or if you have different dictionaries, or if you're using different libraries, you can still use those and upgrade to the new version once you're able to get it up and running with the website and go in to locate where the most current version of the OASIS dataset is alongside your legacy version that you might be using now. That way you don't have to reinstall the complete software application from the beginning. The Home Health PPS and the use of the OASIS, it can be found at the Home Health PPS webpage. And on their portal, you also have the educational and training resources to be able to develop a way of implementing the OASIS datasets in your facility, if you're a participating facility. Because of administrative delays, the collection and submission of OASIS data continued until ICD-10 could be implemented completely from the prior version from ICD-9. Once the ICD-10 version was completed and implemented, the ICD-9 became the legacy version, but right now the current version is the ICD-10 version. All right, and let's look at a couple of quick OASIS datasets. The current version right now is OASIS-C2, and the OASIS PBQI and process measures. Those are two process measures that are used for process-based quality improvement initiatives. So what this means is that standardized across all facilities that are participating in Medicare or Medicaid initiatives or programs, the data that you're generating from your facility can be standardized and compared rather than having to be collated from regions and then standardized and then compared and then normalized to see if there's anything noticeable in comparing facilities performance, or use of resources from one region to another. The OASIS Spotlight page on that website as well, it has information and posting of resources, fact sheets, the availability of Q&A documents, information about home health care, and other notifications that are also available. All right, thank you very much. I appreciate it.
Thank you, Juan, for that presentation covering HEDIS. You highlighted some very valuable points that not only help HIM professionals, but can be used by other professionals within the healthcare industry. Once again, at this time, we'd like to remind you all that questions and comments will be addressed after our final panelist has presented. Our final panelist is Kendra Collier, covering Clinical Interchange Standards Consortium. Let's tune in. Hello, everyone. Thank you for joining us today. In this presentation, I will be covering Clinical Data Interchange Standards Consortium, also referred to as CDIS. The coverage of today's talk includes the history of CDIS, governance, purpose and function, structure and components, current use, and benefits of implementing CDIS standards. Let's get started. CDIS is a 501c3 global, non-profitable charitable organization that develops data standards to streamline clinical research and enable connections to healthcare. It was first initiated as a volunteer group in 1997, and there on the screen are other highlights of history. CDIS is governed by its own in-house governing board. It includes members of the FDA, big pharma companies, and other stakeholders within the healthcare industry. The board implements a governance structure and operations that are accountable to CEDIS members and its missions. Updates are done annually and approved by the board. The primary goal of CEDIS, when developed, was to develop a platform with independent standards that would aid in interoperability of healthcare information systems. The structure of CEDIS is very complex and it includes multiple subsets. The CEDIS foundational standards are the basis of the complete suite of standards supporting clinical and non-clinical research processes from end to end. Foundational standards focus on the core principles for defining data standards and include models, domains, and specifications for data representation. As you can look at the image on the left-hand side of the screen, those are some of those multiple subsets that's contained in CEDIS. And the most recent developments, just early last month, CEDIS released an announcement on June 5th that they created a cloud-based shared health and research electronic library, SHARE, platform to free the standards from PDF documents. Now they're easily accessible through the cloud-based metadata repository. And then, again, that is intended to provide machine-readable, curated versions of their standards and ease of use and accessibility. Then on July 13th, CPASC and CDISC announced the public review period for the Duchenne Therapeutic Area Standard. And on July the 20th, TrialKit, a mobile e-clinical platform, announced that TrialKit allows research professionals to accurately measure heart rate, step motion, and range of motion, and the Apple Watch is included in this, and that has completed how motion and health kits are used. And this is important because TrialKit has created this application keeping in mind the adherence to CEDIS standards designed to ensure data submissions that adhere to the clinical interchange standards and the studies that are done. If not already doing so or thinking about it, here are a list of benefits from implementing CEDIS standards. You have a fostered efficiency, enhanced innovation, facilitated data sharing, increased predictability, complete traceability, improved data quality, reduced cost, and streamlined processes. That's all that I have today on Clinica Data Interchange Standards Consortium, CEDIS. Thank you for watching. Great overview, Kendra. At this time, we will now open the floor for questions and comments. For those of you watching as a recording, this portion of the video will be paused. We will not be recording the audience. Let's begin. Well, folks, that's all the time we have for questions and comments. We hope that you found some takeaway points and useful information regarding HEDIS, OASIS, and CEDIS as options of data set and data interface standards to use in your facilities. Thanks for stopping by.